The current practice of using a tourniquet to aid peripheral venous access has hardly changed during the last 80 years. For many patients, relying on this method means multiple stick attempts, pain, complications, wasted time, and additional hassle. The failure rate for gaining peripheral venous access is 10 to 50%, depending on the patient population. But a revolution in venous access is happening now. The Veinplicity device is a portable, easy-to-use electrical stimulation unit. By applying a gentle electrical stimulation to the forearm, Veinplicity increases both local and venous blood volume. This causes both an expansion of the lumen diameter and increases the rigidity of the vein wall. This venodilation enhances stability and reduces the likelihood of collapse if blood is drawn. The vein may now be more prominent on the surface of the skin due to the dense muscle tissue below pushing it upwards. Even after the device has been turned off, the effect continues, as interstitial fluid continues to fill the vein. These physiological changes make the vein easier to palpate, so therefore easier to obtain successful cannulation or venipuncture, even on challenging patients, on the very first attempt. The Veinplicity device offers clear advantages to medical practitioners who need access to peripheral veins. When veins are stiff and easy to palpate, the chance of first-time cannulation or venipuncture without the use of a tourniquet increases. This makes altered blood values from prolonged constriction a thing of the past.
Once I've applied the pad, after a couple of minutes, you can actually visibly see the vessel engorge, and it does help. As a practitioner, you'll be able to access the vessel straight away.
Quick access to viable veins is crucial for patients who are in shock, suffering from decreased blood pressure and in need of IV fluids. When fewer attempts are required, potential side effects like hematomas and vasovagal episodes can also be reduced. The risk of infection lowers too. Veins that are easier to access also increase satisfaction rates and the quality of life for patients. The fewer attempts, the lower the likelihood that additional procedures to gain venous access will be needed.
The Veinplicity device has aided me being able to use a vein in my hand, which I haven't been able to use before because they're very small and it's very painful. But the device helped produce bigger veins and it wasn't painful at all. It's a relief because you've got another vein, another site that you can use and access quite quickly.
I've been amazed by the results I've had from Veinplicity. The device really does increase vessel size, it really does increase success rates for venipuncture and cannulation, and it could really revolutionise practice.
Many patients with darker skin, for example those of Indian or African heritage, have a poor history of venous access. This is mainly due to the difficulty practitioners have in visualizing the veins. By increasing local blood flow and creating a more rigid set of veins, the Veinplicity device aids practitioners in successfully palpating a stable vein, even if they still can't see it.
With the Veinplicity device that we use today, I think it's less painful. Rather than having the tourniquet, it's just a vibration that you feel, and other than that, it's over.
For many patients who have a high body mass index, having blood taken is a stressful experience. It is not unusual for these patients to undergo numerous attempts which result in pain, discomfort, anxiety, hematomas, and poor quality blood results. Additional procedures like slapping, the use of hot packs and hydration are often used, and some patients even have to return another day, incurring additional transport costs and stress.
Well, there's often been quite a few problems with my veins, and when I've had to have cannulas put in before, sometimes the member of staff's had to leave the tourniquet on for longer. It's been uncomfortable, and I have to be honest and say that sometimes they haven't always been able to access my veins at the first attempt, so obviously it can sometimes be a little bit traumatic.
Veinplicity makes it easier for practitioners to feel the veins when visualization is difficult. This decreases the number of attempts and increases the quality of treatment for patients.
I won't be worried about coming in to have this procedure done in the same way that I have been in the past. It's always made me feel quite nervous, and just the whole experience is better. And I hope that it would be available wherever I go for cannulas in the future.
Children's veins can also be hard to visualize or feel, but the Veinplicity device stiffens and elevates veins so they can be accessed on the very first try. This way, the practitioner is more confident, parents are reassured, and children are relaxed and happy.
It's amazing the way Veinplicity has made a difference for paediatric patients by reducing the amount of attempts required before successful cannulation.
As we grow older, our skin and veins become more fragile and are more likely to sustain damage from repeated needle sticks. For many elderly patients, the issue isn't that their veins aren't visible, but often that their veins aren't stable. Since Veinplicity increases blood volume, creating stiff, rigid veins, practitioners have a better chance of hitting the vein on the first attempt. Stiff veins also lower the risk of the needle puncturing the vein's posterior wall. This reduces side effects like hematomas and collapsed veins. Additionally, reducing the use of tourniquets, or doing away with them altogether, results in less damage to the patient's skin.
Elderly patients have benefited from Veinplicity because the device will increase vein availability and vein size. Older people have much frailer, smaller veins. This device can increase the size of those veins, so venipuncture and cannulation can be easier.
They can find them easier. It must be a wonderful machine, mustn't it? Evidently, it brings the veins up. It looked all right. You could see the veins running down my hand, so that must be easy for them to find the veins.
Veinplicity is transforming the practice of venous access, making it easier for medical practitioners and patients. One day, it could change the standard of practice, not just for difficult-to-stick patients, but for us all. Veinplicity is the revolution in venous access.